Hi everyone, welcome back to Interview with Scientist series. Today we have a special guest, Dr. Victoria Sherwood, with us from UK. I would pass on the mic to Dr. Victoria to introduce herself.
Hi, Chinmaya. Hi, everyone. Yes, thank you. Nice to be back and talking to you again about a slightly different topic this time than what we spoke about last time. So I'm a UK-based medical writer. I'm currently freelancing. Prior to that, I was working in big pharma, and before that, I worked for agencies. I was an academic even before that. So a long career to date.
Yes.
But lots of experience gathered along the way. So hopefully this will be an insightful discussion.
Nice. And for those of you who don't know me, my name is Chinmaya and I am from the West Coast in Canada, in Vancouver. I am a digital marketing specialist at PSC Biotech. And I did my PhD before moving into digital marketing. So we will be talking about how AI or artificial intelligence is influencing medical writing and digital marketing. So as everyone knows, like AI is making a big impact, like Chat GPT from OpenAI. Now I have seen like Google's Bard. They have recently launched. I haven't got a chance to try it because it's not available in Canada, but I have heard good things about it. So what do you think, Victoria? Like, how are these AI tools changing medical writing profession, or are they helping medical writing professionals?
Yeah, no, it's a big question, isn't it? And as you said, it's such a huge discussion topic at the minute. Everybody's talking about these tools, in effect, they're nothing completely new. When I was working in big pharma, we had AI tools that were assisting the medical writing teams, various levels in preparing papers, things like that. So, those systems have been out and available. And even GPT itself, I think, was available earlier last year. But I think that the difference is now with the chat interface.
Yes.
It's brought it to the masses, and people are able to see the power of it. It's interesting what you said about Google's Bard. So you don't have it in Canada, is that right?
Not yet.
Because we have it in the UK, and I've been playing around with it.
Okay.
The biggest disclaimer for your viewers is that, I suspect, like most people, I'm a complete beginner on some of these tools.
Yes.
And I'm just getting my head around the prompt engineering and trying to learn a little bit more about how to play with these tools and get what I need out of them.
Yes.
I can't say that I'm using them yet in my personal practice as a medical writer. I don't see anything that they're able to give me that would be client ready or that I could use for a client or anything like that. You can certainly use it to kind of learn as a learning tool, or if you've got a situation where, say a client wants you to work on a completely different therapeutic area that you don't know anything about, you can quickly go now and get a lot of information around the landscape of that therapeutic area, which is fantastic. Okay. Because before that you'd have to find, relevant reviews and things like that. But now you can get a little bit of understanding. But of course you have to be very careful. Yes. Because you have to be careful about the accuracy of that information. So when you've got that information, then you do have to go back and double check. But it can at least give you a starting point, an entry point into a new area. So that's certainly where I'm able to use it now. And also I'm a blogger. So yes. As a blogger, I'm able to use that. And that's where I've been playing with it most. Okay. Because I think it's quite good at like turning some of my blogs into, quick one-liners for Twitter and things like that. It gives me some nice inspiration and ideas. But for my medical writing practice itself, I think, these ChatGPT certainly has a long way to go. Even the paid-for version, which I am playing around with at the minute as well, which is superior to GPT-3 in my experience. But it's a long way to go. And I have actually played a little bit with Bard, not as much. And again, I think ChatGPT can... maybe because people have been playing with it a bit longer, I think the way in which it delivers the writing is better at the minute. but I'm sure Bard will catch up with that and be able to give more information. I'm finding I'm having to prompt a little bit more with Bard to get more information out of it and to get a bit deeper and ask it to deep dive and things like that, which you get up front with ChatGPT, I think, a little bit more. So that's just my personal experience. Oh, and the other thing I found is ChatGPT isn't great at mathematics. I don't know if you've tried to test it.
Not yet.
You have to ask it. Okay, have a go, because you have to ask it to be a mathematician to get the right answer, in my experience. Although, maybe they're going to improve that, but Bard can do the sums straight away. So that's quite, that was an interesting thing I found.
So the reason I wanted to try Bard is because it is connected to real-time internet connections. It has the most up-to-date information compared to ChatGPT 3. I'm still on the free version, and it has helped, but not with the accuracy of the data, as you mentioned. Like when I write blogs for the company, I definitely ask it to create an outline, because starting from a blank page is harder. But if you have an outline of different topics or subtopics, it really helps. But from there on, you cannot rely on ChatGPT. I don't know about Bard, but ChatGPT or any other platform, because they lack that consistency, they lack the information. And I have also tried out different other AI tools like creator.ai, which is another tool. It depends on ChatGPT 3, which I didn't know before purchasing that, but it still doesn't give me relevant information. It can give me, I asked it to give me 10 drugs for neuroscience, which has been discovered in for neuroscience in the past 2 years, and it gave me some made-up names because I googled them and those didn't exist. I was like, okay, so you have to be careful with these things.
Definitely. But that, what you mentioned, overcoming that writer's block, that blank page syndrome, can be really helpful, right? When you're presented with something completely new. I think gets you going at least. But yeah, the accuracy issues are there. But I do think with giving you like a prompt and a layout and things you can start working with, when you go back and you can check the accuracy and then you can find relevant information. I had exactly the same when I started using it. I had exactly the same experience as you. I decided to ask it some questions about clinical trial areas that I understood very well in oncology, and it started giving me back information, this trial with 66 patients with this drug versus this treatment, and those trials did not exist. So it was taking like the number of patients from one trial and the treatment arm, the intervention arm from another trial, the control arm for another, and making it a complete trial up, which, if you weren't aware of that, it's quite, misleading, right? So you really do have to double check. I do think ChatGPT 4 is better. Once you get onto the paid version, you'll see a difference there, and a lot of the reference it gives, are accurate, and it will give you those references. So that's really good. But again, if you over prompt, you can get hallucinations. It will start to make things up. It tries to please you. So you've just got to be very careful.
So are there any ethical considerations like going forward from here? Like if people just copy paste it? I'm sure there are ethical considerations, especially in medical writing.
Yeah, this is something. I am no expert here, but you can see, the ethical considerations straight away around, accountability and things like that, and also the fact that, it's trained on a set data set, right? So your information is only going to be as good as that data set. And then obviously in the pharmaceutical industry, a lot of data has to be confidential for obvious reasons, for commercial reasons, for the ability to generate new drugs, but also from a patient perspective, right? We have important guidelines for ensuring patient confidentiality and having trust of patients to enroll into trials, and we ask them for their consent. So there's lots of questions there around if we're using their information to train AI models, have they consented to that? These are things not within my area of expertise, but I can already see, these raising important questions. And so, one thing very important for medical writers is certainly if you have a data set that's unpublished, don't be putting it into Chat GPT because it's private, confidential information. You shouldn't be using it there. So yeah, there's lots of things to think about in terms of, and the things that as I said, I don't have answers to, but I'm sure some very intelligent people are thinking about these things right now.
Yes, because when we input our, like for example, confidential data into ChatGPT, it definitely stores it in their servers, so one can go back and access them if one desires.
Yeah. Okay. Yeah. Exactly. And also, I mean, so you're taking information from it, but it will only have like a lot of published data because presumably people are not sharing confidential data, hopefully. But then, there's a question, will it need to integrate with electronic health records, for example? Because, that's where a lot of data is stored and is kept. And the real benefit of it that I think, we can benefit from as writers is its ability to analyze trillions of pieces of information and look for trends, which is very difficult for us as humans. And of course, when we have that power, if you can collaborate with them in that way, get those kind of trends coming back to you and then be able to analyze that and of course check the accuracy as we suggested. But that's where I think it could, the synergy between a human and an AI system like that could be really powerful.
Okay, nice. So moving on to chatbots or patient engagement. Let's start with patient engagement. Right now, chatbots are the new thing. Like even on Amazon, you have to go through multiple steps to reach an agent. On some other stuff, do you think like patient will engage more with chatbots rather than a human being, or
I think
will that change?
Yeah, I don't know. I mean, your guess is as good as mine, but I mean, the trend is there, right? People do interact with them. They do like them. We're obviously not there yet in the pharmaceutical industry. I don't think. But I mean, I've heard of people that are using chatbots in-house. So medical information teams, for example, who are responding to patient queries, responding to HCPs with questions about products that are out there from the pharmaceutical industry. Those people, some of those teams in certain companies are using chatbots within their teams to quickly ask questions, and using that AI, leveraging on that AI internally. Now, whether or not that will translate at some point to, patient-facing or an HCP-facing chatbot, I would suspect inevitably yes at some point, but it doesn't appear that we're there yet. But I'm sure very intelligent people are working on these things. So I'm sure, people are thinking about it in a pipeline.
Yeah, it's a long way to go still because we just started with these trends. And personally speaking, I don't like, if I'm a patient, I want to talk directly to a doctor because a chatbot cannot answer all my questions. And it will take its own time to connect me to a human being on the other end. So, apart from ChatGPT or Google Bard, are there any favorite AI tools for image creation or any other prompts that you use or American writers use?
For me, no. I haven't had a chance to look at the image creators. I had a play around with one that reads PDFs, which was really good.
Okay.
So you can put a PDF in. Which one was that called? PDF. It's escaped my memory. I'll have to text it to you later, Chinmay. I can maybe put it in the write-up. But I've only had to play around with it. Basically, it can take a PDF, read it, and regurgitate, the sentinel pieces of information for you, so you can take them away, which I thought was quite useful. But somebody had mentioned to me, I don't know if this is true, but there's a plugin on GPT that you can also do something similar. So I was going to look into that. Because if there's a plugin that you can use it there as well, you don't need to then keep going and trying all these different tools. I feel like we're in a little bit of a state of, when music streaming started, right? And there was like Napster and all these others, and you didn't know which ones to use, and eventually everybody ended up using Spotify or so I think we're a little bit in that stage, aren't we? Where there just seems to be, every time I look at Twitter, there's another suggestion of another AI tool, and it becomes rather overwhelming. There's only so much we can play around with and test. But I'd like to have a go with some of the image creators. That sounds really interesting, doesn't it? Yeah, have you tried any?
Yes, I have tried, but I was not satisfied with the results because what if I prompted, for example, a beagle enjoying a day in near the sea with sunglasses on, and it created an image, but it was almost half made, and sometimes it was pixelated. So if I put it on a
Oh.
blog, it won't look good, and I can really look into my from my eyes and see like, okay, this is not the image that I wanted. Maybe a
Mhm.
stock image would be much better for my blogs rather than going through this. So I think, but Mid Journey, I've heard a lot about Mid Journey, which creates really accurate images. So I have to try that. You
Mid
have
journey. Wow. Okay.
so that's one tool that I'm waiting to try. It's available, but I didn't get time yet to try it.
Uh, I'll have a play around. I
Yes.
really do feel like, a total beginner. And I'm sure, as I said, a lot of people feel like this, but like an infant, trying all these new
Yes.
things and, trying to see where they,
Where they are
how they
going.
can aid your daily work
Yep.
and life.
Yes.
And I do question when I start using ChatGPT more regularly, it seems to be changing search, right?
Yes.
Because you may now go to ChatGPT above Google,
Yes.
which, is going to revolutionize how people live if that's the
Yes.
case, right?
Yes.
So, yeah, it's interesting times.
Yeah, it is interesting times. Like in 90s, computer or AI, not AI, sorry, computer was a boom. Computer technology was a boom, and it hit us big. In 2000s, I saw like biotech was a big thing. Like everyone was saying, go and study biotech. Biotech is the future. And now AI in 2020. So for my son and for the next generation, I would say like in 20 years, they would be using AI like anything.
Yes.
Just to
Yeah.
do their
Well,
homework and everything.
driving a car, right?
Yes,
Everything.
things are changing, and yes. But have you seen those papers like ChatGPT passed a medical exam in the US?
Mm-hmm.
That
Yeah, I've seen a
was,
couple of those. Yeah.
yes, that was a bit shocking for me. Like AI can do this, so if it goes into wrong hands, like students who don't want to study, they could use these kind of technologies to overcome these things, like a medical
Yes.
exam.
Yeah.
So that's
Yeah.
scary.
Yeah, no, there's lots of things to think about, and and things for legislation, right? That's going to start having to be addressed
Yes.
because, well, I know for firsthand, my nephew's doing a dissertation at the minute,
Yep.
and he built basically most of it using ChatGPT, as did most of his cohort. If he'd been submitting that dissertation this time last year, he'd have had to have written it all how we did,
Yeah.
and look up every individual reference by hand and find them. But he found it very useful as well. So I'm sure most students are using these kind of AI powered tools to some degree.
Yes.
Whether they're checking the accuracy of the information, I kept pressing on him. You must go away and check everything you've got.
Yes. No.
Because you can't trust it.
No.
As we've discussed.
Yes. Because that is something whenever someone asks me in digital marketing, hey, can we use ChatGPT? I said, of course you can use it to generate your Facebook caption or anything, but be careful with the accuracy because sometimes it doesn't provide the right information, and if you post it, it might backfire. So
yes,
that is very important
yeah.
to keep in mind.
Yeah, because at the end of the day, the responsibility still sits with us, right? As the writers or whoever, is the author of the information.
Yes.
So, yeah.
There was a funny incident. Like someone asked me, "Hey, can ChatGPT give me stock information?" I said, "Yes, it can, but it is not that updated." Okay, I'm using ChatGPT 4. Go for it. And he said, like, "Okay, I want to invest in this stock, because ChatGPT suggested me to do that." I was like, "Okay, but there was also a line written there, like, don't trust my information. Be careful." As with any investments, so you should be careful. And when he looked up those stocks online, those were not that highly profitable stocks. So ChatGPT 4, but they have still a long way to go. And I think ChatGPT 4 is still using data from 2021.
Yes.
So
yeah, and I think that highlights a really important point that we should make as well from a medical writing perspective, because there's an inherent bias on any of the whatever the size of that data set is, there
Yes.
will be biases there.
Yes.
And so also thinking about, your data that comes back, how balanced it is
Yes.
against all the other data that's out there as well is something to think about. So there is a long way to go
Yes.
before it could be used without, being unquestioned.
Yes.
But it's very early days, isn't it? So
Yes.
we'll have to see how things develop in the future.
Yep. So before we end this discussion, I just wanted to ask you this burning question, which has spread like wildfire. Will AI replace human writers, and we will lose our jobs in future?
I think there's lots of people asking that. My sister's a GP. She was asking me yesterday,
Yeah.
do you think we won't have doctors in a few years because, in 10, 20 years because
Yes.
of AI? Because you'd read an article about how, diagnosis will be improved,
Yes.
way more accurately than currently is. And even surgery could be more accurate with robots.
Okay.
And scans and looking at people's bodies and then being able to do all the surgery, through a robot. And I said, well, I think, there's a long way to go before a patient would just be comfortable, as you said, talking to a chatbot and then
Yes.
turning up at hospital and not having interaction with anybody. So, I doubt that. You have to worry at your age whether you
Yes.
lose your job. But yes, I mean, getting back to the whole writing thing, things are going to change. I mean, I think for sure there's a lot of companies at the minute don't really know what to do and are telling their writers, don't use these tools
Yes.
under any circumstances, things like that. But I mean, eventually it's going to become integrated into part of the workflow, if nothing else, because of the efficiency it can improve. And also getting back to that point that I made about trends,
Yes.
very difficult. If you do a literature research as a one person, it could take a long time. Doing gap analyses, things like that we were doing. It would take a team maybe a month or so of, in-depth research and work before you can come to some conclusions. Now, if you've got a system that can look across trillions of pieces of information and pull those trends in, efficiency saving there is enormous. Yes. But again, getting back to all those things we're discussing, it's not able to critically analyze at the minute.
Yes.
It's not able to interpret the data in any way that I can see. And, you need to quality check. So all these things mean that, there definitely has to be, a trained writer there. And when you get into things like, thinking about strategic thinking or upholding ethical,
Yes.
standards that we have to think about in terms of, marketing and compliance and patient safety and all these things we've discussed,
Yes.
It can't do any of that, right? So at the minute, absolutely, writers are going to be necessary. But
Yes.
some of those more mundane tasks of, sifting through literature, maybe even, quality checking, grammar, proofreading, these types of things,
Yes.
maybe those things, can become automated and actually, we'll see a change in our roles.
Yes.
So yeah, that's how I see it at the minute. Obviously,
Okay.
it's an ever changing field.
Ever-changing
I don't know.
field.
What do you think, Chinmaya? Do you disagree?
Well, I have a 50-50 opinion about this because I have seen like ChatGPT cannot create the human touch. Like, if I'm writing about for example, a death in the family, I have to write a condolence message. It won't create that impact that I can as a human create because it will just write, okay, this is the message that you can send. But that will not be humane to, or will not that have feeling. So that is lacking still, and I think that's still a long way to go that it can replicate a human. Yet at least in marketing. And yes, it, as you said, it can do some mundane tasks like create a tweet for me or write a summary for this blog. I give you the prompt. This is the blog that I wrote. Write a summary of this. That is something that it can do just by copying, pasting, and reading through that document. But yes, I would suggest like one thing that everyone should try. I have been trying is going through the um, agreements that you sign up. When you sign up on something, there is an agreement. If you just copy paste that into ChatGPT and ask it like what data it is storing, because we don't have time to go through the whole 20 points,
Mm.
it can point that out. And that is something that I find very useful in my daily
Mm-hmm.
use. So,
Yeah, that's a great tip. Yes, because how many things do we sign up to with terms and conditions, and you never
yes,
have a chance to read them
yes,
because you switch on and it's like a PDF of 50 pages, and
50
like, no
pages.
way.
Yes.
I
So,
just want to book my holiday.
yeah, you never know if it is storing your information or how it's
Mm-hmm.
going to use your information. So ChatGPT is really helpful in that way for me,
Mm.
because it really points out, okay, the system is going to store your data and this will be used in this way. Do you consent or not? Now I can make a informed decision rather than going through that
Yeah.
50 page. So that
Mm-hmm.
is really helpful. But
Yeah.
yes, AI
But
technology.
I do think we're on the verge of collaborative workflows. I do
Yes,
think they'll be coming, and they'll be coming very fast and soon,
yes,
because of the productivity, and efficiency savings that companies can make on that respect, because they can
yes,
deliver more,
yes,
basically,
yes,
with the same workforce.
yes. But yes, ChatGPT and AI technologies are coming up, so we need to keep up with it. That's the
Mm-hmm.
whole point. And it reminds me of a movie of Tom Cruise, Minority Reports, which was way ahead of its time. And this was, I can feel that. Even the
Mm.
cartoon Jetson, it was very futuristic, and this is this is what I'm seeing.
You're taking me back there, Jim. I had to think, but yes, now I remember it.
Especially Jetson, like I could see the future. I never imagined, like, okay, we are not flying in the air, we are not going by air. But yes, most of the things are automated now, and it was way back in 90s. When I was a kid, I used to watch that. And I used to enjoy, okay, this is the life of future, but now I see that in reality.
Yes. Yeah, let's hope we don't see something like the Terminator.
Oh no, that would be disaster. Thank you very much, Victoria, for your time today, and I really appreciate uh, discussing this new trending topic with me.